Happy Saturday morning. I am really excited to share with you about our week and some things that have gone on at Remnant Initiatives this week. This week, our volunteers were eligible to receive the COVID-19 vaccine as part of the state's distribution rollout. We are in phase 1A, group 2. And we are in the same group with, say, corrections officers and folks who provide services to people living in congregate housing and whatnot because of the work that we do and the exposure that our volunteers have to COVID-19 because of the folks that we work with. And so I want to put a couple things into context before I get deeper into how that rolled out this week. In Yamhill County right now, the latest statistics that I have are that we have had 3,202 positive COVID-19 cases in the county. Our county has a population of about 107,000 people. So that represents about 3% of the population. Contrast that to the Department of Corrections, our prisons in the state of Oregon here, where we have a population of about 13,000, and they now have logged 3,252 positive COVID cases among the adults incarcerated in those institutions, plus another 772 staff positives. So that's roughly 25% of the people that are housed there, not counting the staff positives. And that's a big reason that our work in the last few months, well, last year, I guess it has been almost a year, has greatly shifted from not just helping people get out of prison and back into community with the tools that they need to be successful, but to make sure that they come back in a way that does not threaten the public health as well. But protecting public health and public safety has been exposing our volunteers to potential contracting of the virus. And that, as a nonprofit leader, has been really stressful for me. So getting vaccinated this week was super important. And it was also amazing. I got to give a shout out to the folks at Yamhill County Yamhill County Public Health, and to Tualatin Valley Fire and Rescue, and all the other volunteers were there. The whole clinic was efficient, and you knew what you were doing every step of the way. You were well prepared, but everyone there, from those of us who were receiving the vaccine to those who were managing the process to those who were actually giving you your shot, was the whole thing, the ethos was so joyful. Like we all knew we were doing something really important, and it was our privilege to do so. So as I mentioned, phase 1A group 2 also includes corrections officers, and I have women that I talk with on the phone or a message through the secure messaging process at Coffee Creek, and they have shared with me that the officers have been receiving their vaccines, but that some of the women that are incarcerated there are also receiving their vaccines. And that's really important too. There's a lot of controversy right now in our criminal justice and public safety world about when do incarcerated adults become eligible? When should they have the vaccine? And so at least at Coffee Creek, some of those folks are being able to be vaccinated, and that's great. But even if the Department of Corrections made a commitment and had everyone there vaccinated, which I don't think is going to happen, but let's say they did, these folks are still going to come out of prison sorely prepared to re-enter mainstream society in ways that help us all realize healthier and safer communities. Let me explain. Most of the people that I talk with about our work really believe that when someone goes to prison, they are being put into an environment with a robust rehabilitative process in place, that people are going to get job training and drug addiction treatment and mental health care And I've heard some people say, well, don't they get a college degree when they're there in prison? And the reality is that everything about our prisons is designed to control dangerous people. But the vast majority of people that are in our prisons aren't dangerous people. And with the rise of mass incarceration over the last 40 years, what's happened is all the programming, treatment, job training, education, and whatnot, that keeps getting defunded until now what we're kind of left with is a system by way of design, both in the way the buildings are built and the way the staff are trained. It's a system that by design ensures that the people that live there don't think for themselves, don't make their own decisions, that they're simply supposed to comply. Don't solve your own problems, don't have any ideas, just do what you're told. And after months and years of this, the neurobiology in the human brain is actually shaped by living in this environment for so long, so that by the time someone gets out and comes back into community, their brain has literally lost the capacity to problem solve and make good decisions. And that's why at Remnant Initiatives, we think it's so important that our volunteers have relationships with the people that are returning to our communities so that they can walk alongside them as those neuro pathways are re-energized and come back into motion. What do you think of that? How's that working for you? What can I do to help you? You might want to rethink that decision. These are the kinds of things that we do all the time. And it's also the reason at RI we're very fond of saying that the real work begins at reentry. Because the reality is, when people are sent to prison, the nature of the setting and the overcrowdedness, the lack of funding, that they're not being prepared to be successful when they're released. Quite frankly, it's an abysmal waste of time and human potential. And here in the state of Oregon, we spend $45,000 a year per person to incarcerate people who aren't dangerous to society, to ensure that when they walk out, they're kind of set up for failure. When you walk out is when you have to figure out how to get a job, how to rent an apartment, how to pay your bills, how to do all of these things that maybe you and I take for granted because we've just always done them. But the formerly incarcerated now have to do that with the stigma and all of the barriers of having a criminal record. So we spend $45,000 to put people away where they're not having the root causes of their criminal behavior addressed. And then the machine spits them out for us to get busy and do the real work of rehabilitation and reintegration. Are we okay with that?